Awesome. Okay, so yeah, once again, Dr. Strang, thank you so much for joining us and kind of going through answering these frequently asked questions about like the vaccine, about the pandemic that a lot of students have been having over the past few months and past like over the course of this year itself. So I'll just start it off here, and this is kind of just like an overall little question. So like, what is the difference between the Pfizer and the Moderna vaccines?
Yeah, so thanks, Ben, and I'll just start. Thanks for the opportunity to. It's important that students get good, accurate information. There's lots of misinformation out there, so my overarching message to start off would be that for people looking for information about COVID vaccines, make sure you're going to a credible place. So whatever I can do to help with that, my pleasure. So really, Pfizer and Moderna they're both mRNA vaccines, and it really is a brand name. There really is no substantive difference between them, and people say it's kind of like choosing between Pepsi and Coke. They're both cola drinks. They're both equally and highly effective against 2 doses, against providing really good protection against the current strains of the COVID virus, and they both have very similar safety profiles. Overall, very safe vaccines.
No, that's fantastic. Like that's definitely the way that it was explained to me when I went and got my first shot was yeah, like one's Pepsi, one's some Coke, kind of like whatever you take your fill, you can kind of make your choice. But it kind of does bring up a question like is there one that's more or less effective than the other?
No, they're both equally effective. They have very similar safety profiles. And I think one of the questions that comes up around mixing, and if you get one type of vaccine, should you try to get the same type of vaccine for your second dose? And the answer is really ideally yes. But if you're going to delay getting your second vaccine, so let's say your first vaccine was Pfizer,
okay,
and it's going to take you a lot longer to get your second dose if you wait for Pfizer, we highly recommend that you get get whatever mRNA vaccine is first available for you to get your second dose, regardless of what your first dose was. So it's fine to mix the 2 types. Just we want people to get immunized with both doses of vaccine in the shortest possible time frame.
That's fantastic. So overall, like just very similar safety protocols, same kind of effectiveness for both of them. Kind of brings up like another question that I've got in terms of the vaccines, and that's kind of in terms of side effects. So are there any common side effects like for teenagers and young adults who get the vaccine? And like, do these different types have different side effects?
Yeah, no, their side effects are very similar. I mean, the common side effects are what we call local reactions. You can get some redness, a bit of swelling, tenderness, sore arm for a day or so. Some people, and it's more common with the second dose, and this is more common if you have Moderna, one type one, okay, and then the other for the second dose. You can get like a very limited for basically around a day or so of what we call systemic effects, fever, aches, and chills and aches, just feeling a bit unwell. But that is very short term. As I said, if you mix vaccine types, it is a bit more common, but there's no long-lasting effects from that. It is time limited, and what it actually means is that the vaccines, it's an indication that the vaccines are working. Your immune system is being stimulated, giving you some of these symptoms. So if you don't have them, it doesn't mean it's not working, but if you do have them, it is actually a sign the vaccines are working, and it's not going to cause any long-term more serious issues. So it is something you can treat it with Advil or Tylenol, very short term, non really serious side effects. What we have seen, and it's important that people understand this, there is with the mRNA vaccines in young people, usually between about 18 to 30, it is still very uncommon, but we're seeing a slight increased risk of myocarditis, which is an inflammation of the heart muscle, or pericarditis, which is a buildup of fluid in the sac around the heart. All of what's been seen, those sound scary, and very often, but first of all, they are still rare. But there is an increased chance of this happening. What we're seeing around the world, in Canada and Nova Scotia, is that people who do have this, they may often have to go to hospital, be hospital for a short period of time. But people are recovering well with what we call non-invasive or just supportive treatment. So really just being observed in hospital for a short period of time. Again, the vast majority of people who get the vaccines aren't going to get that, but we need to make sure that young people are aware of this. And we do have this information. Anybody getting vaccinated would have to go through an informed consent process. And there is information about this through that informed consent process. But again, it's rare, doesn't cause any serious, long-lasting kind of impacts. But we're seeing this in a slight increase in the young people. So people need to be aware of that.
Okay, so fair enough. Like, so we're seeing kind of like similar common side effects between like the two different doses of the vaccine, or two different breeds, sorry. But at the same time, nothing really substantially long-term or that will affect you that isn't treatable over a long period of time, is what you're saying.
Yeah, and I just saw it today, so today is Monday, August the 16th. We've just, on the Nova Scotia government coronavirus website, if you click on the vaccine section, there is information on this, and we've just finished off a little video clip on myocarditis, pericarditis by one of the infectious disease specialists here in Halifax. So everything we're talking about today, there would be more information if people go on to that Nova Scotia government coronavirus website, click on the vaccine site.
That's fantastic. So like overall, like we've got these side effects that we know about, and it's just really about like kind of getting that knowledge out there about that, so that people are just a bit more educated in terms of like what can happen, and then kind of know not to have too bad of a reaction when something like that happens.
We always, anything in medicine, people need to have informed consent. They need to be aware of the benefits, any possible risks, and give them an opportunity to make that well and fully informed consent to get in this instance get the vaccination. Just to finish off on the myocarditis, pericarditis, there is a risk of getting myocarditis or pericarditis from a COVID infection itself. So certainly, for everything we know about these vaccines, from the more common, non-serious, local reactions to the rare myocarditis, pericarditis,
right?
The benefit of getting vaccinated and giving yourself very good protection against COVID and excellent protection against severe illness far outweighs any risk of any side effects from the vaccines.
Right.
It's just, so strong recommendation. We're in the middle of a pandemic. The way we keep ourselves safe is by getting 2 doses of the vaccine. And it's far, far, far safer to do that than to risk getting any of the serious consequences of the COVID infection. And we're actually learning more about some of the long-term potential impacts of a COVID infection. Even if people have mild symptoms in their infection, there's growing evidence about long-term neurologic and other impacts from a COVID infection.
Oh, fair enough. Well, Dr. Strang, thank you very much for that super informative response on just the different kinds of side effects that could happen. I think that'll definitely appease a lot of the students we've been talking to. But another kind of question that I've got, Dr. Strang, is what do you say to those folks who might be worried that the vaccine process was rushed, or that we may not know enough about those long-term impacts?
So first of all, the process being rushed, it was fast. However, these vaccines, because there was a concentrated global effort with vaccine companies and governments bringing, and finances brought to bear specifically on developing a COVID vaccine, we were able to go through all the necessary steps of various types of first starting on developing potential vaccine candidates, then doing animal studies, then human studies, ultimately getting to the point where all from human studies on safety and effectiveness is assessed by regulators, and in Canada that is Health Canada, whose job it is to look at all the information from vaccine manufacturers and come to a conclusion about whether the vaccine is actually safe and as well as effective. So all those processes, faster than normal, but all the appropriate steps that would be followed for any other vaccine or any other pharmaceutical drug were followed. So there were no steps that were skipped, etc. So very confident on that. And now we have, since January, global evidence of millions and millions of people who've been vaccinated with these vaccines, and very clear evidence around the strong effectiveness of the vaccines and the benefit of controlling COVID with vaccines, as well as all the evidence we have, what we just talked about, the vaccines being very, very safe. And the other question, people say, well, we don't have long-term studies, but certainly I know we don't, but we don't have long-term studies for anything we introduce in the world. I mean, we have a pandemic in front of us, but what we do know is that the evidence I just talked about, shorter term safety, but also we know that the technology that produces these vaccines has been around for a fair bit of time. And what people should understand is that the vaccine itself doesn't last for very long in your body. What it does is it stimulates your body to create an immune response. And it's that immune response, which is what we always produce when we're faced with any type of infection. It's part of what our body does. That's what gives the long-term protection. The vaccine itself, what goes in your arm, is only around for a very short period of time. So there's really nothing that would, if you look at it from biologically or physiologically, there's nothing that would even suggest that there's any risk of long-term harms from having this vaccine for a short period of time in your body, and then having the vaccine create an immune response, using your body's own natural processes to create that long-lasting protection.
That's great to hear, Dr. Strang. So like overall, one, you've got a vaccine that has made it through all of the potential protocols and the safeguards in place to make sure that process is going well, and checked externally through Health Canada. Then at the same time, that lack of a long-term report really isn't the be-all end-all, because it's your body that's creating an immune response to the COVID variant at that time, right?
Exactly, based on based on the short-term use of the vaccine.
Fantastic. Okay, that's really great to hear. So, like, as we're seeing like a lot of these new vaccine variants spreading, or variants, sorry, of COVID-19, in particular, like the Delta variant, is the vaccine protecting me against all of these variants?
So what we do know, and the Delta variant is the game changer here, we do know that all the variants that are around, you do get very good protection, especially from the mRNA, the Pfizer and Moderna vaccines.
Okay.
But with the Delta variant, you don't get great protection with a single dose. You need 2 doses to get that high level of protection. And that's why that I and my colleagues in public health, for the last number of weeks over the last few months since Delta came onto the scene, we've been pushing this message that you got to get both doses of vaccine. One is not enough, and that's why we're focused in Nova Scotia. You'll hear us talking about people need to be fully vaccinated, which means they need to get 2 doses of the mRNA vaccine, because that is what protects us against the Delta variant. When you look at what's happening around the world, where you're getting outbreaks of the Delta variant, it's where you have significant groups within a community, within a population, who either only have one dose of vaccine or have no doses of vaccine, where you're not seeing to any large extent the Delta variant causing COVID illness in populations where they have high levels of fully vaccinated individuals. You will get occasional people, no vaccine is 100%, and some people will get what we call breakthrough. Even if you got 2 doses of vaccine, you may get a very small number. In Nova Scotia, we've got less than 1% of our overall cases since the beginning of the year, 2021, have been people who are fully vaccinated. So, and even if you get these occasional breakthrough cases, those people will tend to have mild disease, probably less able to spread the virus to others. And if most other people around them are also fully vaccinated, what it means is that even though you may get this odd breakthrough case in a highly immunized population, the virus is not going to spread and you're not going to have big outbreaks.
So especially like for those that are saying, well, if the virus continues to mutate, what's the point of me getting the vaccine? It's actually the opposite. If you get all of your vaccinations, you will be better prepared to actually protect yourself and others in the long run.
Well, that's true. We can protect you against what we know is out there. And especially with these mRNA vaccines, if the virus changes a lot, because they're based on, people may have heard the term, these spike proteins, they can adjust what the spike proteins are in the vaccine and produce a new vaccine in a fairly short period of time.
Wow.
But the other more important thing is the situation where we're likely to get more variant strains arising is when we have lots of circulation of the virus and we have lots of people who aren't yet vaccinated, because that's when the virus keeps circulating around and can start creating new variants. If you have lots of people vaccinated, there's not nearly as much chance for the virus to spread amongst lots of people. It's the spreading amongst lots of people and that the viruses exchange genetic material and create new variants. So again, if you're worried about new variants, well, then the thing that you can do to protect yourself, protect others around you, and contribute to low levels of circulation of the virus is getting fully vaccinated.
So yeah, you kind of already answered a question that I wanted to ask you there with that last one, which is, what's the worst thing that could happen if I don't get vaccinated? Like, I'm young, healthy, and like, won't we have like that herd immunity in place? But as you were just saying, it really is about making sure that we are able to stop the mutation, like stop the variation of different strains of COVID right where it stands by getting kind of vaccinated across the board.
Yeah, I think, and that's one factor. I think even if you're young and healthy, being unvaccinated, put you at the greatest risk of getting a severe disease. And we know, if you look at the United States right now, where they have large numbers of, especially younger people who are unimmunized, the people that they're seeing that they're dying and in ICUs are younger people who chose not to get vaccinated. So by choosing, if you choose to not get vaccinated, you are putting yourself at risk for severe disease. But you're not just putting yourself at risk. There are other people likely around you. You may have somebody in your family, or you may have one of your friends who, because of their underlying health conditions, we know people whose immune systems don't work as well, whether they're because of aging, maybe they have a disease like rheumatoid arthritis, they're on medication for. There's lots of people around us who may not respond as well themselves to the vaccine, and they're relying on the rest of us to help keep them safe. So your choice about vaccination is not just about yourself, it's about protecting everybody around you as well. And if you're in a university environment, if you choose to be unimmunized, what you're going to be contributing to is a greater chance of the virus spreading around campus and lots of other people becoming sick. And one of them may be the ones that get severely ill. So again, the choice for vaccination is as much about caring and helping protect the others around you as it is about yourself. It's an opportunity for us to do what we've done well in Nova Scotia all along, is to take care of each other. and do what's necessary to control and prevent the spread of COVID. And this is the latest step that we need to do, is all of us who can get vaccinated.
Fair enough. That's awesome, Dr. Strang. I think that's definitely one of the main things, is really getting that info out there about this is the best way to protect yourself and the others around you. From what we've seen, is that there's also a bit of the hesitancy that's coming from a lot of the conflicting information that's out there right now. So like theories talking about the vaccine making you magnetic, or that the vaccine might contain like a microchip or a tracker. Does the research support any of these theories, and is there something to be worried about there, Dr. Strang?
None. That's all tied into the COVID conspiracy, anti-immunization kind of narrative that a very small minority of people are trying to push. I can't say it often enough. I mean, the social media and the internet is great, but what it allows is the people to put information out there with no filter at all of truth or validity. And part of what we all need to learn is how do we actually be discerning on what we actually read, what we follow, what we actually believe, and what we listen to. So in the space of COVID and COVID vaccinations, you got to have a healthy dose of skepticism and really trusted sources. That the Nova Scotia government site, we have links to Public Health Agency of Canada, CDC Atlanta, some other, and people say, well, those are government, that's part of the agenda. Well, I mean, that's a huge conspiracy theory. Why would we want to knowingly put misinformation out there when we're trying to keep people safe from a pandemic? It just doesn't make sense. So, I mean, trust us a little bit. Do your homework, absolutely, but make sure you're relying on credible kind of government websites, and be really kind of careful about who you follow and listen to on whether it's Twitter or whatever.
For sure, and thanks for setting the record straight on that one. I think it's super important, especially with just like, and you're totally right on that aspect of things. Especially social media, it's a beautiful thing, but at the same time, how much information can spread in a short period of time is really crazy. So I definitely appreciate you kind of setting the record on that one. It's awesome.
Well, I can make another comment there. What people may not realize is that, look at how much misinformation was very deliberately spread, and this has been shown around the U.S. election, the presidential election. The same things are at play. So there are bots. There's very organized anti-COVID, anti-vaccination groups out there who are actively spreading all sorts of misinformation through Twitter, Facebook, all those kind of things. So really have a very healthy dose of skepticism, and before you accept, even if you're looking at any, before you accept anything as truth, do some homework and look into, well, where is the source of that information? Why would they be saying what they're saying? And again, have a healthy dose of skepticism, but also know that there are people that are out there and organizations that are very actively manipulating the social media space to kind of drive their anti-COVID, anti-vax narrative.
Yeah, thank you for adding that in, because it's definitely a large aspect of this as well. And I agree with you. I think it's a super important message for almost all things is, really make sure that you're doing your research, and that the facts that you're going for are from sources that you trust, and that are kind of seconded by some other sources out there. So that kind of tallies things up for the questions that we had specifically about just the vaccine in itself. But there's definitely some on the student specific side that are coming to the forefront now. So the first little question that we've got here is that there's still a lot of promotion around pop-up testing and potentially on-campus testing sites as well, like once we all come back to campus for the new school year. So if I've already had both doses of my vaccination, should I still be getting tested? Yeah, I think that's kind of
Yeah,
typical.
right now we're in the process of wrapping up that pop-up testing. We
Okay.
know, two things, that if you've got both doses of vaccine, you got a low chance of actually having COVID. And especially in Nova Scotia, we don't have right now, we don't have any community transmission of COVID. So if you're somebody living in Nova Scotia, you recently moved here, you've got 2 doses of vaccine, uh, we're really moving away from having those people tested unless they have symptoms. We're going to
Okay.
focus our asymptomatic testing, which will really help us keep track of where the virus might be as we get through the fall in Nova Scotia. We've a bunch of workplace testing. Um, if we need to, if we start to see signals from workplace testing or other where we start to see cases, then we'll move back in
Okay.
again with very focused. We might, say if there were several, if we had a few cases on the campus, we might then come in with our mobile vans or one of our pop-ups and go to
Right.
do testing again. Whether we do that or not will depend what happens throughout the fall. But we need to move away now from the asymptomatic testing because if we're testing lots of people who have a very low risk of getting of actually having the disease, what we're going to get are false positives. And we were seeing that
Okay.
very recently with our workplace testing. It's showing that the workplace testing is working because we're picking up some positives, but each of them were then doing the confirmatory PCR test, and they're all turned out to be false positives. Um,
Okay.
we use the pop-ups for when we needed to, and we'll use them again if we need to. But we're shifting our testing as we are now in a different phase of the pandemic, moving from the pandemic response to more with living with COVID. We have to keep some kind of testing out there, and we'll have more information coming out soon, including across campuses around the type of symptoms you watch for, and if you have those symptoms, certainly go and where you would want to then go and get a test.
For sure. And that's I think it's just great to hear in general that you guys the infrastructure is already there, the kits are available, and that infrastructure is really flexible to move anywhere throughout the province at a given notice, just in order to like best take care of the population that may be getting affected in that sector, kind of thing. So that's excellent. I'll just move it on, and this is kind of more specific to international students that are coming back for the fall semester. So for these international students, there may be some confusion around like the different requirements that are in place. So the first real question we've got in terms of international students are, if you are coming from abroad, are you able to get a vaccine in Nova Scotia?
Absolutely. If you're coming here, it'll be studying here. We're going to make sure that you have access and you can get properly vaccinated with a COVID vaccine. We are in the process of developing some steps so people who were vaccinated in their home country. There are some vaccines that are approved in Canada. There's a bigger number of vaccines that are approved by the World Health Organization. And in some countries, they even have vaccines that aren't even that have been used, but haven't actually been approved by the World Health Organization.
Mhm.
So we're putting together information for international students so they can look at that and say, what vaccine did I have? And what, if any, additional doses of an mRNA vaccine do I have to have here in Nova Scotia to be considered fully vaccinated? So we're working with our post-secondary institutions and the international student population very closely, over the days and next few weeks ahead to make sure the international students have all that information, and if necessary, they can get the vaccines they need to be considered fully vaccinated here in Nova Scotia, even if they may have had some vaccines in another country.
Okay, so fair enough. So will there be an isolation requirement for international students if they didn't receive one of the vaccines that is approved by Health Canada?
Yeah, we have a policy in place now that they're first of all, if they're international, they'd be coming through under federal requirements,
Oh, yeah.
and if they don't meet those federal requirements, they have to go through a quarantine process.
Okay.
So I mean so the Fed, and I know the federal governments are looking at that policy. So yeah, I think the best thing to do would be any international students who are not yet here should be hopefully looking with at the federal government, the Health Canada and the Public Health Agency of Canada information about what they would need to do. But certainly once they get here, we'll also continue to work with them. And as I said, make sure they have good information so they can look at what they've gotten. And if they need to have any additional doses of vaccine, it would typically be just a single, one more dose of an mRNA vaccine for us to then consider them fully vaccinated. But again, we'll be having lots of information going out directly on campuses in much more detail than I can go through right now today.
That's fantastic. So once those students do arrive, will there be an option for them to receive that vaccination on campus, or is that just going to be a conversation between the province?
We're working with the post-secondary institutions, maybe through student health services, but what we're going to have through the fall, we've done a lot. We've had a lot of our vaccination has been delivered through local pharmacies. So we're working with the universities. So you're from St. FX. We absolutely make sure that there are local pharmacies in the town of Antigonish that people can go to get if they need additional, whether they're an international student, maybe they came from Ontario and they still need a second dose, or maybe even 2 doses of mRNA. We're going to make sure that students can get to a local pharmacy, regardless of what university they may be going to.
That's absolutely fantastic, Dr. Strang. And I'm sure there's a lot of international students and out of province students like myself that'll be incredibly relieved to hear that. It's fantastic news.
So I would just in there say, stay tuned, people. If they haven't, there'll be lots of I'll use, because you're from St. FX, there'll be lots of information coming out through St. FX to the St. FX student population on this, and specific to the town where you'd go to get vaccinated in the town of Antigonish, or in Acadia, in Wolfville, or Halifax Peninsula, St. Mary's, Dalhousie. Much more institution specific information will be out there.
Perfect. So basically, regardless, there will be options for students to be able to go out, get that vaccination. Fantastic. That's a beautiful thing right there.
It's a priority for us to get as many students, post-secondary students, vaccinated through the next few weeks, so we can get into the fall with very high vaccine coverage on our campuses.
I love to hear that, and it's great to see such an institutional push from all these universities as well. And speaking specifically about St. FX, we've really seen that Back Together campaign, really making sure that they're pushing the let's get 2 doses and being able to cut down on those quarantine requirements, and also some of the restrictions that were in place in class last year. I know that a lot of students are feeling really optimistic about this year that's coming. Really looking forward to it myself as well. So just as a bit of a final question, just what would your key takeaway messages for students returning to classes in September?
So I think, this has been the last year and a half has been hard. Recognize that. Been hard to, it's been difficult learning, not the same as being in class. But we are in the middle of a transition from that kind of acute response to a pandemic. We have to more living with COVID. It's going to be here for a long time. The fall is kind of tricky. It could be kind of a little bit bumpy. That we don't have all the answers. But I think we've done a really good job at Nova Scotia. We have very low epidemiology. We're working to keep it that way. We don't have any community transmission. But the key way we do that is having everybody who can get 2 doses of vaccine to get both doses of vaccine. So that's what will allow us to avoid having to go back to virtual learning, to not having people in classes. The other piece of this is that even though once we get a high, meet our minimum target of at least 75% of the population with 2 doses of vaccine, we will no longer have restrictions and the mandated measures like masking and physical distancing. Strongly encourage people to keep doing some of the things you've been doing, better hand washing, being careful about especially the number of people you're in close social contact with. We're going to strongly recommending, even though there wouldn't be mandated, that as we get into the fall, we're recommending people that still, especially if wearing a mask, if they're in an environment where they're in close contact with lots of other people. It won't be required, but so again, hanging on to some of these things that have helped kept us safe as another layer, but the most important layer is vaccination, 2 doses.
That's fantastic, Dr. Strang. That really kind of finishes things off for our interview today. But I just want to say once again, thank you so much for allowing us to have the opportunity to ask these questions. And we can't wait to get this information out there because it really is important.
Well, thanks for being part of the part of the work against COVID and doing that work and getting information out. And I just want to wish everybody a safe and successful return to school come September. And I know if we all work together and keep doing the right things, that we will have a safe and COVID safe fall semester.
Certainly, that's fantastic. Thanks again, Dr. Strang.
Take care. Have a good day.
Take care.